Our objective is simple. We're going to ensure that there are no taboos when talking about gambling harms. Our ambition is to upskill every community to talk freely about gambling harms and for communities to be able to provide practical information, advice and guidance to help on tackling gambling related harms, just as any first aider would do. Welcome colleagues, welcome skeptics, welcome friends, and welcome fellow travellers on our journey to tackling gambling related harms. I'm Graham England, I'm the Chief Exec of ARA, Recovery for All, and I'm privileged to be hosting this webinar to launch this game-changing qualification. A little bit of housekeeping. This webinar is being recorded and links will be sent out in the next few weeks to people that have attended, and it will also be available on the RSPH website. Your mics have been muted, so please use the question button to ask any questions, and we'll have time to answer these towards the end of the seminar. We'll endeavour to answer as many questions as we possibly can. So we've got some great speakers today who will be telling us how this qualification came about, why it is necessary, how tackling gambling harms fit with the bigger picture and the wider strategies to prevent gambling related harms, how the outcomes will be evaluated and how this qualification will make a difference. And finally, we'll be hearing from somebody who has lived experience of gambling harms and their thoughts onto its usefulness and how to use it. Just a little bit of background for you. ARA Recovery for All is proud to be a long-standing GamCare partner and part of GamblerAware's National Gambling Treatment Service. ARA passionately believes people can change and recover. 5 years ago, to this very week actually, ARA was part of the Association of British Bookmakers, at the time, Gambler Awareness Week. And there we met with 80 frontline betting shop staff and talked to them about what would happen if their customers got in touch with treatment and help. And that was very successful. And in fact, we got quite a lot of direct referrals from betting shops in Cardiff, actually. But what was evident was that this group of transient, predominantly low-paid staff had lots of responsibility for regulatory compliance for the operators. They had compliance training from the operator, but they had very little or no practical skills or knowledge on how, when, and where to discuss gambling harms with their customers. So I talked to my colleague Neil from Beacon, and this was his observation too. So being Neil and Graham, we decided to do something about it. So Bet You Can Help, a practical first aid model for gambling harms, was born. Bet You Can Help is the basis for tackling gambling harms, the level 2 qualification that we're launching today. So on to our first speaker. I'm going to pass you over to Christine Marriott, who's the CEO of the Royal Society of Public Health. And she's going to talk about the role in the societies played in developing this qualification. And just a quick note, sadly, Christina has to leave for another appointment straight after this, so she'll do her talk and then be leaving us. But thanks, Christina.
Thank you, Graham, and apologies everybody for that diary clash. I would have stayed for the whole webinar if it was at all possible. So thank you for joining us today for the launch of our new Level 2 qualification in tackling gambling related harms. Royal Society for Public Health is the world's oldest public health organisation, and we are committed to using education and policy development to improve the public's health. And this qualification demonstrates how our policy work and our training can align. We developed this award with several volunteer organisations from our Gambling Health Alliance, Beacon Counselling Trust, Addiction Recovery Agency, and Unite the Union. And we are delighted to showcase to you the first Ofqual regulated course focusing on this issue. This qualification will also form part of our upcoming Communities in Charge of Gambling project, an offshoot of the Gambling Health Alliance workstream, which is funded through a partnership with GamblerAware. And I will just start my presentation, if that's okay with you. Hopefully everybody can see the screen. Okay, so to give you some background on our work to date on gambling, 2 years ago, we investigated young people's relationship with gambling. Our report, Skins in the Game, revealed that young people consider gambling an increasingly normal part of their lives. This is largely due to gambling being embedded through gaming, through loot boxes and skin betting, and the association of gambling with sport. Our research with young people found that 54% see the relationship between gambling and gaming as a negative one for young people. And we called for children, parents, and carers to be educated on gambling harms. Also in 2019, we established the Gambling Health Alliance. The Alliance brings together organisations and individuals working to reduce the harm from gambling and advocates for gambling to be considered a public health issue and approached and treated as such. In its response to the Gambling Act Review call for evidence, the Gambling Health Alliance outlined how we can take a public health approach to gambling, including opportunities for education on gambling harms. Now, the Royal Society for Public Health provides qualifications across a whole host of public health issues, spanning health protection and health improvement. This training is designed to support the public health workforce, as well as the public, including health champions living and working in communities across the UK. And we offer a variety of courses and qualifications in areas that might be seen as more traditional areas of public health, such as alcohol, smoking, substance misuse, and nutrition. In the area of gambling, we offer an e-learning course, Understanding and Responding to Gambling Harms, a brief guide for professionals. But we saw an educational gap in the public health workforce training to skill professionals to a level beyond brief interventions, comparable to training in other areas of public health. We feel this is a really important step forward in making sure that from an education and training perspective, the issue of gambling harms carries the same weight as those more traditional areas of public health. As the recognition grows that gambling harms is a public health issue, we need to build the public health response to this, including in workforce and public skills. It's vital that we give the wider workforce, wider public health workforce, professionals, community champions, the public, the skills and knowledge they need, and the recognition they deserve for having those skills and knowledge. And this slide illustrates why that's needed. To understand why we need the training to tackle gambling-related harms, we can look to the evidence of the levels of the harm experienced. So estimates suggest that up to 20% of the population experience harm from gambling, either directly or as an affected other. Gambling can negatively impact mental health, physical health, relationships, finances, employment, and education, and it can lead to suicide and premature mortality. Recent research from the University of Oxford showed that as many as 1 in 4 gamblers are harmed. Pre-COVID, it was estimated that 55,000 children and young people aged 11 to 16 experience gambling problems. Gamblers are 5.3 times more likely to take their life than the rest of the population. And for some gamblers, the pandemic has exacerbated their risks. So lockdowns have impacted the way people gamble. With the closures of bookmakers, regular gamblers often move to new methods such as online gambling, with 15% spending more time and more money gambling under lockdown than before. This potentially has very harmful consequences, given that there is little friction between the gambler and the endless opportunities to gamble online. As with many of the lasting impacts of the pandemic, the accumulated harms that we are talking about in public health, these new habits some gamblers have picked up could cause further harm in the medium and the long term. So the Gambling Health Alliance, which we chair, has called for the Gambling Act Review to take a public health approach to gambling. We must prioritise prevention of the harm for the whole population, based on the evidence of the impact of the problem and of its drivers. Along with making the gambling environment safer to prevent harm occurring in the first place, there must also be a comprehensive strategy to reduce gambling harms. And this must include educating professionals working in communities to recognise gambling-related harms. These workers must be supported to effectively signpost individuals to further reliable sources of information and to deliver clear and consistent messages to raise awareness of the impact of gambling-related harm, and then be able to signpost to the support and the treatment services that are available. As I mentioned earlier, the award will now sit within our suite of health improvement qualifications, which our centres have used to train over 55,000 health champions since 2014. It's a level 2 qualification, which means it is broadly equivalent to GCSE at grades 4 to 9. My notes helpfully say, or an A star to C in older money, and for some of us that's not quite old enough. Again, we feel that this is both an important incentive for people to come forward to learn about this vital area, as well as the very well earned recognition for the vital work that the professionals do. It is regulated by the National Qualifications Regulator, Ofqual, and this is really important because it means that the award meets the gold standard in terms of design and validity. It is assessed by a short multiple choice question assessment, which can be completed either online or in person at one of our accredited delivery centres. Now, I know that assessments are rarely enjoyable, but this is one of the real strengths of a regulated qualification, because the learner comes away with the real confidence and tangible proof that they have developed the skills and the knowledge that they need to make a difference. There are 2 learning outcomes of this qualification. The first is to understand the nature of harmful gambling and gambling-related harms and their impact on health and well-being. And the second is to know how to provide help and support to an individual at risk of or affected by harmful gambling and gambling-related harms. So this qualification is very much about the combination of supporting learners to understand the nature and the scale of the issue before building their skills and confidence to support others and make a difference. We've got a fantastic and packed lineup of speakers today, so I'm going to finish there, having given an introduction to the qualification, and thank you very much for your time. Thank you.
Thanks very much, Christina. That's great. It's great to know that the qualifications are linked to the oldest public health body in the world. So it's fantastic. We're going to move on now to Neil Platt. He's the clinical director of Beacon Counselling Trust, and Neil's going to talk a little bit more about the content and the development of the qualification and award. Neil.
Thanks, Graham. Good afternoon, everybody. As Graham said, my name is Neil Platt. I am the Clinical Director of the Beacon Counselling Trust. And Beacon is one of the major education, treatment and support providers within the National Gambling Treatment Service. And we deliver services across the northwest of England. It's my pleasure to be here today and talk about the launch of the RSPH Level 2 Award in tackling gambling-related harms. Now, today, as Graham mentioned earlier, is the culmination of nearly 5 years' work in partnership with ARA, Unite, the Union, and the Gambling Commission strategy for reducing gambling harms. And of course, our now relationship with the Royal Society of Public Health. Also integral to this is our relationship with the National Gambling Treatment Service. And as part of this particular course, the first of its kind in the UK, it is about engaging with the National Gambling Treatment Service to allow seamless integration for those who require additional support and intervention. Next slide, Gray.
Yeah.
Are we seeing them? No slides.
Apologies.
Sorry about that. Okay, can't get good staff, can you? There's the part of the right. Okay, so we're talking about the Bet You Can Help program, which is the vehicle to deliver the new Tackling Gambling Harms Level 2 Ofqual regulated award. So it's gambling related harm accredited training that is delivered primarily through a first aid approach. And now currently that is delivered free to the programs that we have around criminal justice, the South Asian and workplace partners. Now that's the workplace charter program that we have. And I'll encourage people to look at that a little bit later on, and we'll provide the link. That's currently, I say this training will be free, subject to financial constraints. So, you know, we're offering this on a free basis for people to enroll at the end of this particular webinar. So it promotes universal community-based focused education and brief advice and interventions aimed additionally at what we class as the key vulnerable groups that we see as to have them having the potential to engage with or suffer from gambling related harm, such as our diverse communities, individuals within the criminal justice system, the armed forces community, the homeless cohort, and those within the workplace. I just wanted to really just to drill down on some of Christina's figures before we start. We're talking about a prevalence somewhere in the region of about 340,000 individuals identified as problem gamblers in the UK. And that's validated both through the surveys within the NHS and within the Gambling Commission. So from a gambling related harm perspective, yeah, the YouGov report or the YouGov piece of work last year indicated about 13 million people experience gambling related harm. The young person's figure that Christina illustrated earlier on, about 55,000 11 to 16-year-olds are considered problem gamblers. And then the other issue is around hidden harm, where the piece of work from Citizens Advice suggests that as many as 4.3 million people may be affected by gambling related harm. We then look at some of the more catastrophic issues of suicide. And, you know, we have the issue of problem gamblers are up to 15 more times at risk of suicide than the general population. And some more recent information from Gambling With Lives indicates that up to 650 gambling related suicides each year within the UK. We then additionally got the issue of products and online gambling. And we know that that has increased by over 24% in the last year. And then more interestingly to me is that we've got the issue of National Gambling Helpline data. Now, what we're doing, we're reflecting here and saying there's millions of people who are affected by gambling related harm. But out of those, and in particular, the 340,000 problem gamblers, only 3% access treatment, about 10,000. And we get about 40,000 individuals accessing the helpline. So we've got a big disparity here, big disconnect by what we see within gambling related harm and the impact of it, and those that are accessing support services. Now, whilst the new level 2 course is an educational platform, we see this is something of an equation really. And that equation is that education with community intervention, in our view, equals prevention. And the Bet You Can Help team's vision is that the level 2 award in tackling gambling related harms delivered through the Bet You Can Help program as the first universal accredited education platform is to increase those figures into service, to drill down with those and to facilitate an increase into treatment from about 3% to 15%. I say over the next 3 years, that's a tall order. Between the next 3 and 5 years, we want to increase that figure to that penetration level similar to other addictions, as well as providing early support to those at-risk groups I mentioned using a first aid foundation. So what is the Bet You Can Help framework? So first of all, it's a first aid approach to gambling related harm, engaging the first point of contact within communities to ensure that every contact counts. As Christina said earlier on, it's going to equip learners with gambling related harm knowledge, skills, attitudes, and the ability to engage with and facilitate early intervention. And then ultimately to signpost and refer to specialist provisions within the National Gambling Treatment Service. Now, linking to the Gambling Commission's national strategy and that free service within the NGTS. So in terms of the development of Bet You Can Help over the last 5 years, I think, what we know about gambling related harm has been really fundamental here. So what do we know and where do we go in that knowledge base? So I work within the NGTS, I work with the Gambling Commission and the National Strategy. I work with GRIO and I work with Gamble Aware. That's provided a real evidence base here. We have a core component of lived experience through our Northwest Service User Group, Gambling Harms Northwest Alliance. It's been fundamental in the development of this program, along with Problem Gambling Solutions, which I'm going to talk about a bit later, the ARA Service User Group, and other individuals that have accessed the Beacon service. Our professionals and partnerships within the field, we've done an awful lot of work from our perspective with Lancashire Care, with the pilots of this course. That's Lancashire and South Cumbria and NHS Trust, who have been fundamental in the development here. Wigan Council, we did the pilots with them as the first local council and council of the year to sign up to the Workplace Charter. We've got our work with the Trade Union Congress, which signs up to the Workplace Charter on the 13th of September. 49 unions of 5.5 million members, big piece of work there, and our work with Unite. And then all this underpinned by the national strategy and a public health approach. The reality of it is we know an awful lot about gambling related harm in the UK, but maybe we don't know everything. But we do know more than enough to take action. And this is an action through community mobilisation course. So this is the development. We often hear about people talking about a public health approach, but this is a public health approach in action to engaging with gambling related harm. So what we're doing here, we've got this universal education platform, which is population wide, and that then has the ability within communities to target vulnerable groups and to facilitate those into treatment. So this is a public health approach in action. Our early intervention, our education and early intervention protocols in the UK has some system deficits. I think that's clear, which our optimism is that what the course will engage with. So the course is designed to prevent the escalation of associated gambling related impacts, including mental health, financial, relationship issues, criminality, which we see as a big issue, risk to employment and within the workplace, study with students, suicidal ideation and intent. And something else that we see is compromised parenting, which is not spoken about an awful lot in this domain. And that's the parents' capacity to safeguard children from, which is really important, where we see the issue of young people's gambling, and in particular with the issue of intergenerational transmission from one generation of the parent to the child, etc. And we believe that this course will engage with that particular issue. So a quick overview of the programme and what does Bet You Can Help consist of. So module 1 is an organisational perspective to the various organisations that we'll be dealing with. And we do have the facility here, whilst this is a generic course, to use some and to build into some ethnographic and sector specific cultural differences here that we've got in the likes of the criminal justice and our South Asian community work. So we can build that in for module 1. Module 2, we're talking about gambling in the UK landscape. In module 3, we've got the identification and the offering of support. Module 4, a background to specialist support, treatment, signposting and referral. So we're covering all the 4 bases here. Individuals then have the opportunity to go on from a CPD perspective to the RSPH Level 2 award and the assessment paper in gambling related harms. Every individual that attends the course will receive a comprehensive booklet as part of the programme. I thought it might be useful just to maybe to reflect on some of our service user involvement here in the development of this course. This course has been developed with major input from various service user groups, both national and local. And within the handbook, we have a number of illustrations and images from our service users describing their journey. The most important issue that they have that they feel it needs engaging with, within this particular domain, is the stigma of gambling related harm, which massively prevents the healing process. And this is the primary hurdle here as they see it. I think it's important just to reflect on this for a moment with some of the issues that we see. I thought it was really interesting. I was at a presentation last week with GamCare about new national helpline statistics. And within that, we were talking about the affected others, as we call them, of those who are affected by somebody else's gambling. The figure for those accessing the national helpline is down about 30% over the last year. And it maybe it's some relationship with COVID, etc. But I couldn't help thinking the reason why. Now, I'm not going to go through all of these and read out these slides here. They're there, and the slides will be circulated later. But we do know from our Affected Others conference only a couple of months ago that the depth of this stigma is significant, and it's a major barrier to people accessing support services. And as part of that, we need people to get them across the stigma line. Now, the stigma line, as we see it, is that line that prevents individuals accessing treatment. And through the course, one of our primary aims is to destigmatize the issue of gambling-related harm in a similar way to other mental health initiatives. And the way that we do this, in our opinion, is to engage with education and promote this consistent set of messaging universally across the population, and then engage with some of these hard to reach and vulnerable groups. As part of the course, I've sort of saved one of the best things really to last here. I want to talk about for a minute the app and the website that I've been privileged to be part of the development of, called Don't Bet Your Life on It, in collaboration with PG Solutions, with Joan Pete Holloway and Terry White. Now, Don't Bet Your Life on It blends lived experience with clinical expertise to deliver safer gambling strategies in a very simple format, devised by those with lived experience at PG Solutions, to be accessed anytime, anywhere. It is one of the key takeaway components of the new Level 2 course. In reality, this app will prevent any life to be needlessly affected by gambling related harm. Great piece of work. I'm proud to be part of that. Finally, just to bring things together, I think just to reflect on the Bet You Can Help mission statement, we heard a lot about the stats, and I've given you the background to the course. And ultimately, we want to drive down the numbers of people suffering gambling related harms, in particular within communities and grassroots level, while at the same time increase the numbers of individuals accessing appropriate treatment and support. Our mission statement and our mission is underpinned by a strong belief that those in helping roles are best placed to be mobilized as community connectors, building on the Communities in Charge of Alcohol programme delivered through the RSPH, to engage and to support those individuals most in need. We believe that this course will do that. Thank you for listening.
Thanks very much, Neil. And I think what's worth reflecting on as well, as Neil was speaking, and he was talking about 10,000 people getting engaged with gambling treatment. I think it's worth worth saying that there's about £6.5 million go to gambling related treatment in Great Britain for 10,000 folk, which is about the same size as the city of Bristol, where I work, gets for drug and alcohol services, and they see around 3,500 people. So it's a very good deal, and with more funding coming, we'll be able to tackle and see more people. I think that's really interesting. We've got a couple of videos now that we're going to show for people that were people that wanted to endorse the tackling gambling related harms level 2 qualification. So if we can play them, that'd be great.
I'm chair of Eastern Jamia Mosque in Eastern Bristol. Learning about gambling, the associated harms and the effects on our communities is a vital resource within our communities. I think this course is going to be brilliant for the whole of Bristol, but especially where there's vulnerable communities that are hard to reach.
It is about time that we tackled this issue head on. It's time we learned about gambling harms. It's time we were given the everyday tools to tackle this issue head on. I fully endorse the course.
We need to have the conversation. We need to learn about gambling and its effects on both the individual, how it harms them, and those attached to their lives.
Hi, I'm Terry White. I'm the co-founder of Don't Bet Your Life on It, also a former betting shop manager and professional gambler, and sadly also a former FOBT addict. I know very well from first-hand experience how bad gambling issues can be for everyone concerned. But on a happier note, really excited about the possibility of people being trained as first aiders. This will get the subject of gambling talked about at a much earlier stage and should help preventing serious harms happening.
Thank you. I'm going to now move on to Dr. Jane Rigby, who's the Prevention Director at Gamble Aware. And Jane's going to be talking about gambling harms in the wider context and how this qualification will fit into a wider strategy. Thanks, Jane.
Thanks, Graham, and thanks to everybody involved in today for inviting me to speak. As Graham said, I'm Prevention Director at Gamble Aware, and I've been asked to talk about Gamble Aware's strategy and how this work fits into our strategic approach, and about the importance of education in helping us deliver that strategy, and why the programme of work that we fund RSPH to undertake is central to helping us deliver our aims. So I'm just going to share my slides, if this works. Do let me know if you can't see these. So for those of you who aren't familiar with Gamble Aware, we're the lead commissioner of prevention and treatment services for gambling harms in the UK, or in Great Britain. Our charity was established to keep people safe from gambling harms, and we work very closely with a range of stakeholders, including government, so particularly the Department of Culture, Media and Sport and the Department of Health and Social Care, as well as the NHS and public health bodies in Scotland, Wales and England. And we've got lots of stakeholders, local authorities, public health teams, public health professionals, providers. Our charitable objectives are here on the screen, and specifically around advancing education about preventing gambling harms, particularly for people who are young or who might be more vulnerable, and working to keep people safe from gambling harms through the delivery of a public health model. We commission services, we commission research, and we do awareness raising activity, providing grants for effective treatment prevention work. In terms of the delivery of our strategy, as Neil neatly outlined earlier, the public health model that we work within, I think, will be familiar to most people in the virtual room today. What we know is that effective prevention can't be done alone. As commissioners and service providers, we can't do this by ourselves, and we need to work with other people in government departments, with the regulators, with the NHS, healthcare providers, etc., to make sure that we've got a coordinated approach to reducing gambling harms. And this programme of work fits neatly into that ambition. We recognise that gambling harms don't just affect the gambler, so we need to be thinking about that wider community of people who are affected by gambling harms. We've done some research looking at the prevalence of gambling disorder and gambling harms across Britain, and what that highlighted was that there's a real need to strengthen and improve both the treatment and support that's on offer, filling geographical and other gaps around addressing the needs of diverse communities, but also developing those routes into treatment. So it's a really important part of the pathway to get this education piece right, to make sure that those people who are in contact with more vulnerable groups are able to recognise and identify gambling harms. And we know that to do this effectively, we need to work with people with lived experience of gambling harms. So that's why this programme in particular has such a novel and important approach. In terms of our operational strategy, we published a new 5-year strategy in April. It's available on the website begambleaware.org if anybody's interested in looking at that in more detail. But in summary, we've got a strategic vision of a society where everyone is safe from gambling harms. And we know that there's a lot of work to be done to get there, but the core aims are around making sure that people clearly understand what gambling harms are, that the system comes together to collaborate to prevent those harms, that we help people to get to the support that they might need, and that we can continue through doing all of that work, building the evidence base and disseminating that evidence base so other people can develop interventions that work for the communities that they serve. So our vision is that in 5 years' time, we're all in a society where there's many fewer people experiencing gambling harms, and those that do get timely and effective support. So this is where the early intervention comes in, that there's improved awareness of the risks of gambling, that there's reduced inequality both in experiencing gambling harms and in accessing the support and treatment that's available, and that stigma is reduced. So to achieve those things, there's a lot of work to be done. We've established 4 commissioning objectives. So the work that we will do will be around commissioning activity that meets these 4 objectives. And that's around increasing awareness, increasing access, building capacity amongst various different professional groups, and commissioning an effective treatment response. I just wanted to talk about 2 of those in a little bit more detail because they're particularly relevant to this work today. So commissioning objective 1 is around increasing awareness and understanding. We know that gambling harms are hidden. There's not much awareness of the fact that gambling can be harmful amongst the general population. And even in the professional population, there is still a lack of recognition that gambling disorder is a health issue. I think it's changed significantly, certainly the last 5 years, but over a number of years, there's been an increasing awareness of the fact that this is a health issue. And I'm glad to see that continuing to improve, but there's still much more to be done. And we know that that lack of awareness probably contributes to the stigma that people feel about talking about gambling harms. So the work to increase understanding, we hope, will in turn reduce stigma and enable people to talk more openly about the harms that they might be experiencing. And in terms of building capacity, we know that people who are engaged and in contact with the general public through their work are probably already dealing with people on a day-to-day basis that are experiencing gambling harms. It might be that they are addressing those harms and have got a good response, or it might be that they experience that stigma themselves. They don't particularly want to talk about it. They don't quite know what to do. They don't feel necessarily that it's their job. So there is work to be done to make sure that that kind of potential perceived gap in knowledge and skills and confidence in addressing the issues can be addressed through training and education. We've particularly identified a few groups of priority workers in the public health landscape that we want to encourage to receive training and education. And this programme supports much of that work. So as we said earlier, we know we can't do this alone. It requires a whole system approach, and we need to work with a range of people, including public health agencies, local authorities, treatment providers, and voluntary sector organisations, just to name a few. We need to underpin it with research and evaluation, which is why I'm really pleased to see that this work has got a key evaluation element to it. And we need to work harder to reach those people who might be socially excluded, or who may have more complex issues. And we want to do this through engaging communities, really, working where people already facing these issues are. So taking a local place-based approach to our commissioning. And that's why the Communities in Charge of Gambling programme is so important to add into our knowledge base about what works for communities. I just wanted to summarise by giving you a few examples of the work that we commission, and then just talking a little bit about the work that we do with the Royal Society for Public Health. As Neil alluded to earlier, the National Gambling Treatment Service is a system of providers who work together to deliver treatment across Britain. We commission this system and we work with the system to continually improve and quality assure the work that's done. And I think actually we're seeing a rate of around 11,500 people per year at the moment. It's increased year on year, and we are completely behind the aim to ensure that we're seeing many more people come through treatment services. We recognise that the 3% figure of the number of people experiencing gambling disorder who are coming forward for treatment and support, and we want to make sure that we are able to fill the gaps to encourage more people to come forward and have more capacity within that system. We do other work as well, so around the Education Hub programme, we work with a charity called Fast Forward in Scotland. We've been piloting a model of education and training for professionals who work with young people to enable them to both prevent people getting into difficulty with gambling, but also to know what to do should the young people they work with be experiencing gambling harms. And we're about to launch an invitation to tender to roll that programme out in England and Wales. So I just wanted to mention that here as well. It's a piece of work that is a significant programme of work that we want to encourage people to engage with, and we've got an engagement event on, I think it's the 21st of July. So I've got an email address at the end of these slides that you can contact if you're interested in hearing more about that opportunity. In terms of the work we do with the Royal Society for Public Health, we view that strategic partnership as an essential part of the work that we do. And prevention and education is very important as part of that pathway into treatment. So making sure that education is addressed as part of the pathway is essential. We fund the Gambling Health Alliance, which Christina helpfully outlined earlier. And we also fund the e-learning programme that's available through RSPH's website. And the link is there. Again, these slides will be circulated later, so you can access that there. What we know, though, is that getting to people who are working within communities is essential in identifying and effectively responding and signposting people who are experiencing these harms. And giving people the confidence to respond as well, I think, is essential. One of the key barriers that we've heard from people who we've discussed how to better improve their ability to respond to gambling harms has been that either they're not sure it's their job, or they don't want to make the issue worse. So I'm confident that this course will encourage people to recognise that, as with any other social issue that the people that they might be in contact with are experiencing, that this is something that is right for them to talk about. You can reduce the stigma related to it by having open conversations, but importantly, it's not something that they have to tackle on their own. They don't need to be people with particularly specialist skill set to be able to respond effectively, because there is a system available to refer and signpost into. And I think that by working together to break down that stigma through having more open conversations and increasing the confidence of workers and communities in responding to gambling harms, we will begin to achieve some of those priorities that we've set out in our strategy. So I just wanted to end really by thanking everybody in the team who's been involved in developing this, not least Neil and Graham for their thoughts and inspiration 5 years ago when they started to work on the course and think about this in the context of mental health first aid and what that could look like for gambling harms. So I'm looking forward to seeing how this goes when it's been launched, and I think it's a great piece of work. Just to share our email addresses, of course, the slides will be circulated later, but anybody can ask me any questions, and Zoe Blood, my colleague, is responsible for the Youth Hub's work. So if you wanted to get in touch with her, her email's there. Thank you.
Thanks very much, Jane, and well done. I know you've been a bit under the weather today, so thank you very much for battling through that. That's been fantastic. When you were speaking, what reminded me about what I was thinking of was an old adage from a sort of a green political perspective, really, where they was talking about thinking globally and acting locally. And I think we need to make sure that we've got the systems in place and thinking universally about things, but making sure that we empower communities and a range of communities to act at the very local level. And that's how we can tackle stigma. We can make sure that communities are doing things in communities, for communities, by communities, and with easy accessible help should they need it further on. So thanks very much for that, Jane. We're gonna move on now to my good friend and colleague Jess Vole, who's she's evaluation services lead at the Gambling Research Exchange on Ontario, and she's going to be talking about informing us about the gambling harms evaluation, and how this is fit, how we will make sure that this is fit to change the outcomes. So thanks very much, Jess.
Great, thanks, Graham. So for those of you that haven't heard of GREO before, we have over 20 years of experience working in the safer gambling realm. We focus on knowledge mobilization and evaluation to really bring that evidence-based lens of what works and how can we scale it up. So I'm going to go ahead and share my slides. So hopefully you can see that okay. So what I want to do is to take a little bit of a different path today. You've heard a lot about the program, why it's needed, and why it's so important. I want to speak from the evaluation partner's perspective of how we know why we think it's going to work and what those outcomes are that we expect to achieve. I'm going to talk about the Bet You Can Help program, the theory of change, which is what the level 2 course is rooted in. I want to introduce the safer gambling movement, which Neil alluded to, but I think definitely deserves more spotlighting. And finally, I want to talk about breaking the charade, which is a version of Bet You Can Help, and I'll go into more detail about that. I just want to flag that my email is at the end of the presentation, so I'm presenting a lot of very small visuals of the theories of change, but I'm happy to give a copy to anyone who would be interested. So as an evaluation partner, we have a very strong theory-based approach to evaluation. This really helps us avoid that black box evaluation of you launch a program, you evaluate it, you see some outcomes occur, but you don't really know why, you can't really reproduce it, you can't scale it up. So it doesn't really lend to that evidence-based informed decision-making. So we really advocate for developing a theory of change, ideally from the onset of a program, which we were lucky to be involved in with Graham and Neil. And you really use it as a framework for the evaluation down the road. So a theory of change is a very iterative process. I think we had lots of back and forth with the team. We developed the theory of change for Bet You Can Help using stakeholder engagement, using the clinical and professional experience of Graham and Neil, and also looking at the evidence to say, you know, how might something like this work? And what outcomes are actually reasonable and feasible so that we're measuring the outcomes that the program can likely achieve. I'm just going to focus on the activities and the outcomes of Bet You Can Help. I'm not going to go through the rest of the theory of change, but like I said, I'm happy to give a copy to anyone and discuss that. So when we look at the nuts and bolts of the Bet You Can Help training, and I'm going to reiterate a little bit of some things that Neil said earlier, we have a couple pillars. The first I want to really emphasize are the partnerships and promotion. It is such a unique opportunity to be partnered with Royal Society of Public Health and with the support of GambleAware to have this vehicle to offer this program. If you're a healthcare provider, if you worked in a social services, you know that the best laid intervention without the right feet, without the right ability to grow and scale, will never be as impactful as possible. So I really want to acknowledge that that is a really key element of what makes this training so different, is that it's going to be able to be easily accessible through those partnerships. The other activities that are crucial to the program success are the core modules and the specialized modules. So Neil went over some of the core modules, which are around the education and training. And those are really to make sure that people walk away with being upskilled to have those important conversations. So you don't need to be a healthcare provider. You could be a community member, a faith member, anyone. And we want to know that you have those skills to identify that, hey, it seems like you're a little bit stressed. Are you having some issues with gambling? Or giving the confidence to those individuals to do a couple of those kind of brief screening questions. And this is what makes the community first aid model so critical, is that you're not relying on the healthcare providers as the only means for people to come in and receive help and be identified. You're really upskilling the entire population. So that is pretty unique. The specialized modules, again, as Neil alluded to, are sort of those add-on pieces. Those are the ones where there's some tailored content for specialized populations, like culturally and linguistically diverse groups or criminal justice settings. This specialized module is going to link to the Breaking the Sharam program, which is a version of Bet You Can Help, launched in the South Asian communities. So that's kind of the cultural responsiveness element. And then finally, obviously, there's no one size fits all. We know that knowledge mobilization. So the team is also looking at developing some brief workshops, which are a 1 to 2 hour version of the training. And this is really to help the program reach even more people. This could be it could replace the training if people aren't equipped to take the training at this time. But hopefully what we want to see is that actually leads to the training, that these interactions with these community organizations, these kind of taste tests, are nice segues into the full program. In terms of some of the key outcomes that we expect to achieve from the program, in the shorter term, we're really looking at that increased access to Bet You Can Help training, which again is only made possible really through that unique relationship with the Royal Society of Public Health. And through that, we expect to see some increased normalization of discussing gambling-related harms in diverse settings. For those who actually take the training, and this would be something that would kind of repeat as more and more waves come through, we want to make sure that they are having that increased knowledge of gambling-related harms, increased knowledge of available supports, and a self-efficacy to intervene. But knowledge isn't enough. We need those people to take action. So that will actually be something that we'll be looking at in the Breaking the Sharam evaluation and in future iterations of evaluating this program, is what is the link between this knowledge and the ability and actual action to use that in diverse settings. If we take a bit of a longer term lens, we're looking at really upscaling this training and having a cross-sectoral approach. So really there's that no wrong door approach, which is really at the crux of earlier place-based identification, that a person in the system, anywhere in the system, health, social services, justice, education, who's experiencing gambling-related harms, they're going to be able to be touched and identified earlier on, especially before the progression of those harms is experienced. And then finally, we expect to see this contribute to improved population-wide use of prevention, treatment, and support services, and reduce stigma of gambling-related harms. And the ultimate impact at the end of the day, the pie in sky large-term vision, is that asking the right questions at the right time prevents lives from being lost or unduly affected by gambling-related harms. And that is, really something I want to emphasize as part of this community first aid approach. I'm going to segue now a little bit and talk about the Safer Gambling movement, which might be new to a lot of you. So if you've had the pleasure of working with Graham and Neil like I have, you know that they have an infectious, possibly endless energy and appetite for addressing gambling-related harms in diverse ways. So it probably wouldn't surprise you that Bet You Can Help is just one of many interventions that they have. So the Safer Gambling movement is something that we've worked with RM Beacon on to describe in a theory of change, to show how this is like the umbrella program. This is the whole vision in the movement. And all these different trainings, Bet You Can Help, Don't Bet Your Life on It, which Neil spoke to, and a wide variety of others fit with under that. And this is really important to make sure that we're not thinking about any of these interventions in isolation. we're evaluating them, but we're always thinking like, how do they contribute to that bigger picture? So the safer gambling movement could best be described as a grassroots approach to a public health approach. So what is really, I think, really neat is that we have the Royal Society of Public Health and other prevention and treatment providers that are positioned to do a bit more of a top-down approach in terms of supporting policy and funding for a public health approach. But then we have people like Graham and Neil and other partners that they've worked with that are from community organizations that are really bringing it from the ground up and doing some of that work on the ground so that there's nice action on both levels. Like I mentioned, the safer gambling movement, it consists of a wide variety of actual projects, but if we just consider the heart of the safer gambling movement as a whole, I think this diagram does a really good job of describing that kind of continuous energy. It's really a matter of continuing to identify system gaps, engaging those cross-sectoral partnerships, designing, evaluating those different initiatives to learn what works, what doesn't work, when and where, and then igniting that enthusiasm in others. And that's kind of what I hope we're doing a little bit today, is we're igniting that enthusiasm in you, because everyone has such an important part to play in reducing gambling-related harms. We look at some of the intended outcomes of the safer gambling movement. I want to be clear that this is really in support of the national strategy. It's not in replacement at all. It's to support that work. So the national strategy, again, has a really nice infrastructure on the top level, and this is the work from the bottom up that's going to support that. In the short term, we really want to see increased population awareness of gambling-related harms, that increased normalization that we talked about, and more of these unique programs being piloted and trained in different areas. We really want to make sure that there's a real heart and energy for innovation and thinking differently about these problems and what the solutions might be. Longer term, it's the intention that the safer gambling movement will help sustain and grow the legacy of the national strategy, really leading to that earlier place-based identification, improving access to treatment and support, and having those effective prevention programs scaled up. And importantly, we really want to see in the intermediate term, those conditions for collective impact are achieved. And one of those key conditions for collective impact are shared measurement frameworks, which is something that we want to have developed for the safer gambling movement across all projects, but also encourage that to be something that is embedded and taken up by stakeholders in other ways. Finally, the really long-term goal of the safer gambling movement is simply to reduce harm from gambling. But more importantly, it's really building those resilient and empowered communities, because we believe that we can achieve a vibrant public health approach to reducing gambling-related harms. You've heard a lot about a public health approach today, and hopefully you're understanding how important it is to having that wraparound approach. And we really feel like, we're in a position where Great Britain can really have international recognition as a leading public health approach to reducing gambling-related harms through that national strategy. I'm going to finish now by talking about the Breaking the SHRAM evaluation, just to give you a bit of an idea of what this might look like in practice. So Bet You Can Help, which is at the core of that level 2 training. We talked about the core modules and the specialized modules. One iteration of Bet You Can Help, which is going to have those core modules and a specialized module, is Breaking the SHRAM. And this is bringing the Bet You Can Help training to different communities, South Asian communities in Preston and Bristol. So this is going to have a bit of a culturally sensitive lens to it. And what GRIO is going to be doing as the evaluation partner will be conducting a process and outcome focused evaluation over approximately a 1.5 to 2 year period, and recommending improvements in any suggested adaptations. So we'll really be testing the Bet You Can Help model within this group and understanding what opportunities there are to make it more useful, or what scaling it up might look like. And we'll be really employing a very highly participatory approach. So there will be heavy stakeholder engagement and involvement with those communities to help us make sure that we're asking the right questions and measuring the right things. Ultimately, to understand the short-term outcomes of the program, intended and unintended, and again, to discover opportunities to improve the design and delivery. So I'm just going to finish with my contact information slide. If you would like a copy of any of these theories of change, I'm more than happy to email it to you, or if there's any other questions about the evaluation work we're doing, I would be happy to chat.
Thanks, Jess. Thanks. That was great, and it's great to be working with you and to seeing that we've put a theory of change around all of the work that we're trying to do, so that we make sure that we have a framework to be able to measure the changes. And I know there's some questions about that coming up that we'll take. Before we move on, we have some more videos. So there's a few more short videos to be shown. So if we can play them, please.
I'm David Eva, and I'm the chairman of Lancashire and South Cumbria NHS Trust. And I'm really pleased to be able to support the great initiative taken by Beacon Counselling Trust to work with the Royal Society for Public Health and developing a Level 2 award for tackling gambling related harm. Last month, Lancashire and South Cumbria Trust became the first NHS Trust to sign, along with its 9 recognised trade unions, up to the Charter for tackling gambling related harm. I'm really pleased that we've done that, and we will be putting resources into supporting our trade union representatives, managers and line managers within the trust to understand and help people who are themselves facing this difficult problem. As an organisation, we have 7,000 staff across the Lancashire and South Cumbria footprint, and obviously a huge potential for harm to be done there, and important that we are, as an organisation, as an employer, taking that move, but also important that we are, as an NHS Trust, making sure that those skills are available for supporting those in the community who might face that problem as well. I welcome this initiative. Very pleased to be supporting it, and this training adds another layer of help to those of us who are seriously committed to tackling gambling related harm.
My name is Keith Lewis. I'm a learning manager with Unite the Union, and I'm here to express Unite's pride in being involved in the development of this Level 2 award in tackling gambling related harms. It will form a central plank of our work and activity in the workplace, where we raise awareness around the subject and offer support, advice and signposting to members who need it. It will also be the cornerstone of our Harmful Gambling Workplace Charter, where we ask employers and trade unions to sign up to and pledge to offering support around the subject, to offer training to people who want to get actively engaged in it, and also to create that environment where people can actually discuss the subject and be comfortable in doing so. Really happy to work in partnership with employers, with sister trade unions, with the TUC, and obviously with Beacon Counselling Trust and the Royal Society of Public Health, in ensuring that this training is recruited to through our network of union representatives. Also, it will be seen as the kite mark for training around the subject of harmful gambling, both in our workplaces and in our communities.
Hello, my name is Matt Burton. I'm the UK Policing Lead for Gambling. It's my great privilege to support the launch of the RSPH Level 2 Award in tackling gambling related harms. In the context of policing, this is a really important qualification, as we seek to build resilient communities, and communities which can recognise those with gambling addiction and support and signpost them, and hopefully prevent them from committing crimes to fund their addiction.
Hi, I'm Suhail, and I work as an Ethnic Minorities Programme Manager for the Beacon Counselling Trust. We know that minority communities are disproportionately affected by gambling related harm, and from the work we have done at Beacon, one of the factors is a lack of culturally and linguistically irrelevant in-community education. The Level 2 award in tackling gambling harm will only serve to enhance our work in diverse communities by giving community and faith leaders, and also frontline service professionals, the relevant knowledge to support their communities effectively from gambling harm.
Thank you. We're now going to move to our final speaker before we take on some of the questions. This is Rob, and I'll let him introduce himself. And he'll be speaking about his experience, his lived experience and how he could see the need for this qualification. Thanks, Rob.
Thanks, Graham, and good afternoon, everybody. My name is Rob Parker, and I work for ARA as an education and training lead on a youth programme in which we raise awareness and educate young people and also youth-facing professionals about gambling-related harm, particularly amongst young people. Back in October 2017, my secret life of gambling and gambling addiction caught up with me, and I lost my job. And my family and I suffered severe impacts as part of gambling-related harm. Not only did I lose my job, we almost lost our house, and for a period of time, I also lost my freedom. I'd gambled since I was a teenager, but for 5 or 6 years during my mid-20s, gambling completely took over my life. And as I say, as a consequence, we suffered the most severe of impacts. And still to this day, we are still working to overcome the problems that gambling and that I caused myself and my family. Why do I think then there is a need for this training? Well, when I was gambling, very few people ever questioned me or asked me about my gambling. I was quite open that I gambled, whether it be going out with my friends to watch a football game or whether it be at home watching sport on the television. Most people knew that I gambled, knew that I liked to bet, and that sport in particular was a significant part of my life. But as I say, nobody ever questioned me in relation to the monies I was spending or claiming that I was winning, the amount of time that I spent gambling, because I did spend an awful lot of time, whether it be at home or during work, or even the changes of my behavior. Very few people did ever question me about it. And I feel that the question, are you okay, is obviously significantly not enough. One day though, back in February 2016, about 18 months before my secret life, if you like, came out, a member of my wife's family visited from Scotland. He'd experienced gambling-related harm about 20 years ago, and therefore knew quite a lot about it. He'd also supported many people in Scotland through the Gamblers Anonymous programs, and obviously recognised, particularly in myself, that I was gambling too much and that I was struggling with my gambling. I recall particularly because we went to a pub one Saturday afternoon during the Six Nations, and I was gambling on my phone throughout the majority of the time, whether it be on the football through the Saturday afternoon, the horse racing, or indeed the rugby. I think he recognised and pulled me aside for a bit of a chat, but at the time I wasn't really interested. I was in the throes of gambling. I didn't want anybody necessarily telling me that what I was doing was wrong or that in particular I had a problem. But nevertheless, I think the conversation that day did strike a chord with me. I did think about it for quite a significant amount of time afterwards. And now to this day, I actually recall it incredibly clearly. So I obviously was paying attention and did recognize some of the things that he was saying. I think during that last 6 to 12 months in particular of my gambling, if more people, or if he'd have been a little bit more local, had been engaging in conversations around gambling related harm with myself, that it could have prompted me to maybe realize, maybe not to stop, but certainly maybe to seek some support or help. So what difference will this level 2 award make? Well, it's only my opinion, but in the line of work that I do, as I say, we engage with youth-facing professionals. And just recently, I was running an awareness session with a group of family support workers from the Swansea area. Halfway through the session, a support worker put her hands on her head and said, "Oh my goodness," right in the middle of the session. Myself and her colleagues were a little concerned and checked if she was okay. And what we were talking about had actually sort of hit the nail on the head, if you like. And there was a particular case of a mum that she was supporting where she could not put her finger on what was wrong with that family. She had gone through all, drugs, alcohol, mental health, and obviously several other things that she could think of, but gambling wasn't necessarily one of them. And it was because it didn't appear on her form, or that she had never received necessary sort of training prior to this. She contacted me 10 days later to say that she'd made contact with the mum in this particular case, and that it was indeed gambling related harm that was causing the family problems in this situation. And on the back of that, just a little bit of awareness, a little bit of education on that behalf of that professional, she was able to help the mum in particular, and obviously that family. I think this Level 2 award will be a fantastic resource and opportunity for communities, for workplace, and for anybody to help to recognise gambling related harm and to give them just the necessary skills to help those in need access advice and support.
Thank you, Rob. Thank you very much, and thank you for sharing a little bit of your life with us, and it's great to have you aboard at ARA. We do a fantastic job, and our mission is to make sure that we tackle all gambling related harms wherever we see them. So thank you for that. We've got time to answer a few questions. We've got a few questions that come through the Q&A, and I think what we'll do is we'll take them one at a time, and we'll see who's best placed to answer them. I've got an interesting first question. It's from Stephen. Will you be reaching out to UKPHR, FPH, HCPC, etc.? Now, I don't think I'm best placed to answer that one because I'm not quite sure what those acronyms stand for. So perhaps, Stephen, if you could type in what they are, and whilst we're going through some other questions, I'll get back to that one. So we have a question from Nick Phillips, and it's got, with your discussion discussing stigma, is it important, do you not feel, that using terms like problem gambler is being part of the problem? So I think I'll pass that one over to Neil, and because I think it came up in the slides, Neil, where we used the problem gambling, we used the numbers, and it was called problem gambling, but I think that was because it came from the data that we got for the numbers of problem gamblers.
Yeah, it did, Gray. You're absolutely right. I think there's a couple of things. First of all, as you recognise, the terminology can cause challenges, and I know that there's a lot of interest on social media talking about disordered gambling, but the reality of it is gambling related harm works on a continuum. And, within the National Gambling Treatment Service, we are not engaging with people who are just suffering from a gambling disorder. It can be anywhere within that continuum, from social and recreational gambling up to something, something more severe. One of the things I would say is that, whilst I'm not precious about terminology, is that the term problem gambler is something that we find that our service users in particular are comfortable with. Now, I do understand that it may not be appropriate in some quarters, and I think this is one of the challenges and difficulties we have, is to have a set of universal messaging that everybody is comfortable with.
Thanks, Neil. Is any other panelists got any views on that? No, doesn't look like it. Okay. Oh, sorry, Jane.
I could add to that, just to say that we have heard the same thing from people with lived experience about the terminology problem gambler, and we only ever use it in relation to the PGSI, the Problem Gambling Severity Index, so 8+, and making sure that it's only in relation to the cohort that's identified by that screen that we would then refer to as problem gamblers. Otherwise, we use terminology around gambling harms, gambling disorder, where it's relevant. So yeah, I think it's something that's been heard and implemented across the board.
Thanks, Jane. Yeah, and I think some of the data refers to it, so I think we were using that as the same categories. But
yeah,
this is certainly a level 2 qualification in tackling gambling harms.
Yeah, I would just say I do think it is relevant and appropriate to use the words problem gambling in that context, because that is what the screen is, and it's accurate from an evidence-based perspective.
Thanks, Nick. Thanks for your question. I've got one from a question from Rob Burkett, and it says, well, I quite like the first bit. It says, really useful and thanks ever so much. And it said, do we have a project plan that we can that can be shared with others so that they can disseminate. I guess that's a project plan to roll this out. I think in terms of where we are currently, the aim was to make sure that we've got the launch available. We've got the launch and people have got awareness of the level 2 qualification. I'm going to hand over to Neil in a minute again, because he mentioned in his presentation that it is available to groups that we've got funding for. And then maybe I'll ask Jess of how she sees how we could roll it out further with the right resources. So Neil first.
Yeah, in terms of a project plan, Rob, is that today is the launch as such, and we'll be gauging interest from the launch. It is our intention across those 4 platforms of criminal justice, culturally and linguistically diverse communities, the workplace in particular, that we will be delivering this on a free of charge basis. We've got other programs as well that we're just exploring how that we could deliver this on a free of charge basis. The reality of it is, I think we'll probably catch it all as having over 30 million, I think the figure is, of a work age population here. So that I think our anticipation that we'll be able to catch most people on that rollout, subject to financial constraints, and we've got to measure the uptake in terms of the course. Additionally, we've got a new Bet You Can Help website, which is just about to be launched probably in the next couple of weeks. So that will give us another platform as well. So early stages, Rob, really, and it's about us engaging or gauging the response from this. But our optimism is it's going to be quite considerable.
Thanks. And Jess, do you have any comments about how we plan for rolling it out within our theory of change?
Sure. Well, I think one of the important things that we want to do before we integrate it more broadly are have those evaluation activities. So like I mentioned, we'll be starting the evaluation of Breaking the SRAM in the fall. So that will be more of a comprehensive outcome-focused evaluation. But as the program becomes launched now and available for everyone, we'll be building in evaluation activities to have that kind of evaluative thinking to understand what's working, when and where. And when we have that information, we'll be in a bit of a better place to roll it out. But I think that when we think about the theory of change, one thing I emphasize a couple times is that need for place-based intervention. So I think finding more and more partners, particularly outside of your typical healthcare and social services arrangements, like criminal justice settings, like education settings, making sure that we're touching a wide variety of where people may live, work, and play. That would be kind of a vision I see as being really logical to continue that spread and dissemination.
Thanks, Jess. I've got one for Jane, really, I think here. I think and it's from an anonymous attendee, and it says, I think that prevention and training are excellent tools, much needed. This is short and medium term though. What is central government doing to tackle gambling? Its prevalence is huge everywhere. Possibly not a question that can be answered in the Q&A, but I was just thinking that
we'll give it a go.
I'm thinking that we can give it a go. I think whilst as Jess pointed out in her presentation, we do have short and medium term, but we also have long-term objectives to make a difference. And maybe you could link that up to the strategy, Jane.
Yeah, I think it's worth recognising that the regulation of gambling at the moment is being reviewed. So DCMS are reviewing the current Gambling Act, which is looking at this through a public health lens, looking at what can be done in terms of regulation at the preventative end of things as well. The Department of Health, through the NHS long-term view, has made a commitment to additional clinics in relation to gambling harms, and there's a real increasing recognition amongst public health colleagues that gambling forms part of the remit. So it was on the remit letter of Public Health England, for example, a couple of years ago, and it will continue to be part of the remit that is set by central government. So I think there is lots of work happening. It's about how can we as people who have been active in this field for a long time, bring our knowledge and experience to bear to encourage and support the swifter delivery of services and training and programs to support that ambition being realised more swiftly. So again, it comes back to what I was saying earlier about the real need for collaboration. It's great that this is being recognised now as a public health issue and something that needs to be tackled with the same parity of esteem as drug and alcohol addiction or mental health issues. But how can we facilitate that, and how can we encourage that to both stay on the agenda and be delivered at pace? And I think that's where this programme particularly fits in, with the increasing recognition that people need a bit of information and upskilling about gambling harms to enable them to make the change that's necessary. I would expect that you'll get lots of knocks on the door for people wanting to access the training, and it helps bring that whole thing into a bit of a virtuous circle, doesn't it? The legislation will be in place that encourages people to access the training, that encourages people to find out more about gambling harms and therefore support the public with the issues that they're facing.
I think that's absolutely right, and I think that's a nice terminology really. What our whole aim with the gambling, with the safer gambling movement has been is to turn a vicious cycle into a virtuous circle, so that we can drive things up rather than things go down. And also, I think it was clear from what Rob was saying about working with a colleague and who had a light bulb moment. And it's as simple as that, really. It's really great that once we know that people with a problem gambling issue, or when they talk about having been affected by gambling related harms, if you don't talk about gambling very rarely comes up. So we need to have those exact words and get to talk about things. On that, I've a question this is a question for you, Rob, if you're okay with this one, and it comes from David. And it says, how did you get involved initially with working, Rob? I too am a recovering gambler, and I would love to get involved with an organisation to help others not to go down the path I went down. I was at it for 38 years. Thanks for your question, David. And I just wonder if you wouldn't mind sharing how you got involved with us, Rob.
Yeah, thanks for the question, David. So yeah, basically, as I said, I did lose my freedom. So I didn't actually come home until last April. There was a job with ARA advertised in terms of raising awareness and educating young people and youth-facing professionals, which came out beginning of last summer, and I've been doing that ever since, basically. But I get involved with ARA as and when I can in terms of helping service users. ARA was actually part of my initial treatment at the beginning of my recovery, so to work for ARA now is absolutely fantastic, and it's sort of a full circle scenario. And I also front the EBE group, which we have recently just started at ARA. So we are looking for previous service users to come back, to give us feedback, and to help us evolve and move forward. So wherever my voice of experience can be utilised, I like to do so.
Thanks, Rob, and I hope that was of use, David. I think we'll take one more question before we round up. I want to make sure that we've got that we finish on time. I know people have got busy lives. Neil, this one's for you, really. A question for sort of you and I, really. But it says, can you clarify where the funding for Bet You Can Help programme comes from?
Do you want to take that, Gray, or do you want me to?
Yeah, well, I think if you could chip in. I mean, as a chair, I don't want to hog it all, but I think the Bet You Can Help programme was developed primarily by ARA and Beacon, and by me and Neil in our spare time. Really, it was a response to seeing the gap, as I said, 5 years ago, and we decided that we needed to do something practical. And it's developed from there. Some of the funding, it'd be useful now, Neil, if you could talk about how we're able to do some of the courses for free in that category in the categories that you talked about in your presentation.
Yeah, clearly. Sorry, what was the name of the Geiger?
It was anonymous.
Oh, right, okay. Yeah, Graham and I wrote the course, developed the course, and been doing so consistently and adjusting it over the years. The rollout for the course, the evaluation and all the other constituent elements comes from regulatory settlement underpinned or overshadowed by the national strategy. And we've had funding for our workplace charter, which has the level 2 course contained within it. Our South Asian community program, which has the level 2 course contained within it, and our newly commissioned criminal justice program for our working custody suites, which has the level 2 course commissioned within it. And that gives the facility to reach an enormous population on a funded and free of charge basis.
Thanks, Neil. And I think just to sum up the next steps, and I would like to, before I do that, I'd just like to thank, I know Jane's got to go in a minute, so I'd just like to thank all of the speakers today and all of the panel, and most importantly, all of you attendees really for coming along to see the launch of this. I think it's simple, really. It's simple. We just want to make sure that there are no taboos and there are no barriers to speaking about gambling harms in any community in the country. And with that, we're looking to roll this out. We, as Neil said, and as we answered in the last question, we have a certain amount of money that's linked, that we've built into the programs that we're doing, but we'll be looking for opportunities to get this to as many communities and as many of the population as we can. We'd like to think that we can get some people to have awareness and be a community connectors in every community in the country. And what we would like it to be is, we would like this to be viral, and we would like it to be the COVID for good, really. We would like to make sure that wherever people are, there will always be somebody that can talk to them and give them practical information, advice and guidance, and help wherever they are and wherever they need it. So with that, I want to thank you again for attending, and please take care and have a good rest of the day. Thanks very much.